Yeah, live stream's going. Morning, colleagues. Thank you for bearing with us. We had a few technical difficulties just to get going this morning. So if we can begin this meeting of Children and Young People's Committee, can we start with the minutes of the last meeting of the 1st of November? You all have a copy of those minutes in front of you. Can we agree that they are an accurate record? Yeah. Thank you. Apologies for absence. Do we have any apologies this morning?
We do, Chairman. We have some changes of membership for this meeting. So Councillor Henshaw replaces Councillor Henry, Councillor Girling replaces Councillor Roger Jackson, and Councillor Carr replaces Councillor Deakin.
Thank you. Morning to those colleagues who are substituting today. Thank you for taking the time. Declarations of interest by members and officers. Do we have any declarations of interest this morning? No, thank you. So the first item in your papers this morning is the core data set, and this is performance for quarter 2. There are 2 recommendations on page 16 of your papers, which I move.
I formally second those, Chairman, and reserve the right to speak.
Thank you, Councillor Smith. Do I have any questions, comments or observations on these papers from anyone? Councillor Meakin.
Thank you, Chair. Do you want to stand up or can I sit down?
You can sit down in committee meetings, Councillor Meakin.
Wasn't quite sure, thank you for that. My comments, Chair, relate to paragraph 20 of the report, youth offending. While it is welcome, there has been a slight reduction in the first-time offenders. The proportion of weapons offences is significantly higher against the first-time offenders than nationally. I fear, Chairman, that these figures are the tip of the iceberg. In the area I represent, we have 2 of the biggest council estates in the whole county, Coxmoor Estate, where I live, and Kingsway Estate. Residents tell me they are too frightened to call the police after youth nuisance and serious antisocial behaviour. Due to the severe lack of resources that Nottinghamshire Police have, some residents tell me that even if they are brave enough to call the police, their response time is often poor and trouble has moved on or rendering the complaint useless. Do you believe the lack of resources in Nottinghamshire Police, they have 130 less officers than in 2010, mean that on the whole, these figures only tell part of the story?
Thank you, Councillor Meakin. Councillor Girling, you also had a question.
Well, yeah, it's in relation to that, to be fair, Chairman. I represent the largest council estate in Nottinghamshire, Haltonville Estate. And when I first became a councillor there, we had a situation where, like has been mentioned, people were scared and afraid to report incidences. And I just wondered, as a question to you, have you heard of the Report It campaign, which was actually set up by Haltonville Safer Neighbourhoods Group? And what that did was actually gave a platform for people to be able to report in incidents where it wasn't actually those exposed for doing it, because as a councillor, I was the one that then reported it, so taking it on me to do that, and it worked really well. And maybe that's something that might be promoted out there, because it's not really about price and resources, about community leaders actually taking responsibility and leading the community.
Thank you, Councillor Girling. Councillor Lee, did you indicate?
I did, and I love when Keith steals what I was going to say. Keith's completely right. I live, my area is next to the largest council estate, and we had the exact same issue where the antisocial behaviour moves, because Keith was doing such a good job in his area, it then moved to my patch, and we started up the Report It campaign, and we were actually the largest antisocial behaviour increase, 300% increase we had last year in antisocial behaviour. And I'm proud to say that since we started the Report It campaign, I get very little antisocial behaviour reports. So it is about working as a community, working with your district and parish partners, working with your neighbouring partners as well. And it's a great resource to have, Chairman, and that's it.
Thank you, Councillor Lee. Mr Edwards, would you like to respond to the... Sorry, forgive me. Councillor Welsh, you had a question also.
Yeah, I'll start with knife crime. We had a situation in Gedling and Arnold a few years ago, actually, where we had a spate of knife crime, and actually the community were quite angry about it. And a lot of work has been done in the area with regards to that. So to echo a little bit about what Councillor Girling has said, it is about the community working together on this and working with the police. I would say, and they would say, that they are under-resourced. They can't deal with all of the issues that they need to deal with. But I think there is a real option here for a real proactive response from local communities. And I think by working together, you do make a difference. The other situation with regards to knife crime as well, it's the why this is happening as well, which is why it's here at the Children and Young People's Committee. Why are children carrying knives? What is happening and what isn't happening? And I will say, and I don't know if there's anything else that we could do as a committee with regards to speaking to the Police and Crime Commissioner. When I worked in education, when we had the police officers, which I know are working throughout Gedling, although they're not able to get in all of the secondary schools, which is quite frustrating for them, is that police officer and that work that they did within the schools with regards to not just knife crime, but antisocial behaviour, and working with the schools with regards to that, but really working as well with those issues and those support mechanisms for those children that sometimes carry out knives, and when you ask them why, have got no idea why they're doing it. And they're actually the ones that often get themselves into situations and do stuff, and actually there isn't always a history of that kind of behaviour. So I know a lot of work is already going on. I'm really aware of that. But if this is on the rise in Nottinghamshire and we are seeing an increase, it would be perhaps good maybe to invite someone from the police here at some point to talk about what is happening in schools and how we as a county council and local members, like Councillor Girling has just said, if we can work with those officers that are going in schools as elected members and perhaps be that link between the community, that would be really helpful as well. So it's looking about that proactive response. So that's my first point. The other issue I just wanted to raise is the ongoing concern with regards to a prediction of a rise in child protection plans and where we were with that. I know in this report on paragraph 8, page 10, they said there's been a slight increase with regards to that. Are we looking that that will continue to increase nationally? That's what they're suggesting is going to happen. And if there are more, certainly if there are more restrictions put in place January onwards, where families again are perhaps away, children are made possibly away from school, etc., that would further the need. Again, with regards to looked after children, where are we with regards to that, with regards to increases, decreases, and what are our concerns for the future with regards to that? Because I think we've had many conversations before that if it keeps going up, we're just going to have a more and more of a significant problem as the market controls really what's going on financially with regards to this.
Okay. I'll ask Mr Edwards to respond now. I note that Councillor Carr and Councillor Henshaw both want to ask questions, but because we've taken a few, I think we just need to deal with those now. If I can ask you to talk about both the violence reduction stuff and the child protection plans. Thank you, Steve.
Okay. Well, thanks, Councillor Taylor. So the first thing I'd say about knife crime, it is a national sort of issue. There is a difference in statistics between ourselves. I think it's 7% more likely to show us a conviction. That's part of a police-led policy, a zero tolerance policy about carrying knives. So there are no community-based disposals. So that does raise sort of our performance, and councillors might think that actually that's a good thing, that the police are taking a robust action. What I would say is that the youth justice teams, the youth service and the police and now children's social care do an awful lot in the local communities. to disrupt knife crime and gangs, and with the violence reduction unit do an awful lot of work. Operation Taffy in Arnold recently was a really good multi-agency response to a growing problem. We saw a report come to this committee, was it a couple of months ago, I think, suggesting that the youth service could be more flexible in appointing staff, because they very often get calls from the district councils and local groups to respond to particular sort of hotspot areas. And they also know that the Tackling Emerging Threats team are doing a lot of work in schools to support our schools to encourage children not to carry knives. I'm not dismissing it, but there's an awful lot of work that is ongoing, and I hope some of your constituents are reassured by that. In terms of the child protection numbers, they have gone up a little bit recently. I think following the really tragic news about the child murder last week, I think it's highly likely that we'll see even more demand over the next few sort of weeks and months. And of course it's our job to take a proportionate and a measured view towards that, not become involved in a panic, but make sure that we're doing absolutely everything that we can to keep the right children safe at the right time. And I know that the colleagues in the MASH and in the wider service are doing a really, really good job of doing that at the minute. The children looked after numbers that you mentioned have remained relatively stable and still below the national and statistical neighbour average, which I think's a relatively good thing. But I also want to be very clear that in Nottinghamshire, if we think a child needs to come into care, a child will sort of come into care. There isn't a limit, and we make our decisions not based on statistics, but based on the needs of individual children's circumstances.
Thank you, Mr. Edwards. I will also respond on comments that have been made, but if I can just pick up Councillor Carr's question next.
Just really some information about this. Is you talked about hotspots, and some while ago both the County Council and Broxtowe Borough Council identified Stapleford, Beeston, Eastwood as hotspots, put together an action plan which is reviewed every 2 or 3 months. At the last one, I was actually amazed to find that we'd actually got some money from the Police and Crime Commissioner to deliver anti-knife crime seminars in schools. And actually, trying to get the schools to take up the offer is actually very, very difficult. All academies, I have to say. So we've got no control over them. And I think that's very, very disappointing that the resources are there. It's not going to cost the school anything, yet some of them just don't seem to be taking it up.
Thank you, Councillor Carr. Councillor Henshaw, you also had a
yes,
question.
Thanks, Chair, for bringing me in. Obviously, I think even though this is in relation to the knife crime instances, even though it's a relatively small increase, I think we as a committee, or you as a committee, obviously I'm just here for today, should take it extremely seriously that it's an increase. And Councillor Welsh's point, I think, is quite valid, that the answer to this is manifold. Community work, yes, working in your estates, and I represent an area that's got quite a large number of council estates, Ladybrook, Bull Farm, Plesley, Lower Ladybrook, a large area, but not necessarily an area where there is a lot of knife crime. So it's not just on an estate level, it's across districts. But I think the interesting thing about this is, if we tend to work together with the police, with the community workers, with social workers, youth workers, I think you can mitigate instances of this crime. And talking about police resourcing, obviously
the lack of resources over the last 10 years has made an impact. And if you talk to any PCSO or police constable or a higher member of the police service, you know, that lack of resources over the last few years, which is trying to be redressed now, admittedly, has added to this problem. In relation to the report in paragraph 21, the knife and weapons guidance for schools and education has been updated. For one, obviously, I'm not sure whether that's been circulated to all members of the committee, but I would be interested in actually having a look at that if there's any way that, you know, it can be forwarded to us as members for our information. And yeah, let's try and work together to solve these problems. Thanks, Chair.
Thanks, Councillor Henshaw. Do you want to respond on any of that, Steve?
I don't think so, really. We can certainly circulate the guidance, and it's glad to hear that it is recognised that we do a lot of good joint work. I think that's really positive.
Councillor Girling.
Can I just come back in, Chairman? Sorry about this. The resources issue. Yeah, we're very lucky in Nottinghamshire. We've got she's now a chief constable, not just a constable, has been promoted. She used to cover Newark, and she did a brilliant job. Her name's Heather Sutton, and she's been recognised nationally for tackling knife crime. So we've got the resource there. She's got the knowledge. She knows what she's doing, and I think that's part of what we're seeing coming through the system at her higher level. And then just a caveat on if you become a proactive councillor and do these report it campaigns, there will be a spike in reporting it. Now that doesn't mean to say that there's more crime all of a sudden. Yeah, that means actually that it's being reported now. And the police they don't have a crystal ball. If we do not report, the police will not know it's happening. It's okay as sitting there saying, oh, you know, all this crime's going on. But if it's not being reported, then as far as the police are concerned, there's no crime happening. And I think that's the right approach. So it's our responsibility and the community's responsibility to make sure actually they do report it. As community leaders, I think we need to recognise, though, that there will be a spike if we start doing that.
Thank you, Councillor Girling. So just to come back then on a lot of the questions, it seems a long time ago since you asked your question, Councillor Meakin. You haven't been ignored. Both you and Councillor Henshaw touched on police numbers. I think it's important, obviously when we're looking at this report, this is about more than simply the knife crime. That's one paragraph that we've spoken about specifically. I think it's important to recognise what we have direct influence over and what we don't, police numbers being one of those things. That's not to say that we cannot make our thoughts and feelings known where we need to, and also that we should engage in working with the police on things like the violence reduction schemes and the community schemes, anything else that's going on. So I'm glad that several colleagues have spoken about knowing about localised schemes and the positive impact that they have. Mr Edwards referenced some of the work with the Violence Reduction Unit. Somebody else referenced funding from the PCC, Councillor Carr, I think that was you. To reassure colleagues in terms of that kind of work, obviously we are often reliant on that grant funding coming from the PCC's office, and my colleagues in youth services do work very hard to maintain relationships, keep banging the drum, saying that we're available to do a lot of this youth engagement work, and we will keep doing that. And as it happens, I actually have a meeting on Thursday of this week with the Police and Crime Commissioner and the leader of the council to talk on the very subject of youth work, including ASB and VRU work. So it's live, and we are having those meetings and having those conversations, if that gives you some assurances. Obviously, Mr Edwards has responded in terms of numbers of referrals to the MASH, numbers of children potentially subject to plans, the fact that we don't have a crystal ball, but that we continue to engage with families. I think we'll see later in the papers, we've got a couple of pieces of work live at the moment about implementing family hubs, which is about whole family support, and we've got another paper on the whole family safeguarding programme. So I hope as we go further through the agenda, again, colleagues will see and be reassured by the work that is going into attempting to support families before we get to points of needing to think about putting children in care or on child protection plans. And then I think I just want to comment on a couple of things that haven't been touched on in the conversations. And this is about acknowledging the very good and solid work that is going on. So the service does continue to see consistently good performance in completing child and family assessments in timescale. And given the challenges of the last 18 months, I think it is significant that we can make that statement, significant to acknowledge the work of our officers in doing that to protect children. The time between children entering care and moving in with adoptive families continues to improve. There's a lot of work going on within the partnership arrangement that we have for adoption in the East Midlands. And again, I think it is significant and positive, and that we should acknowledge that, because placing these children in future families, long-term families, is significant for their best interests and welfare. So with that, you have the recommendations in front of you on page 16. They have been moved and seconded. All of those in favour? Thank you, that's carried. Item 5 is implementing family hubs in Nottinghamshire. There are 3 recommendations on page 26 of your papers, which I move.
And I second those, Chair.
Thank you, Councillor Anderson. Do I have any questions, comments or observations on this paper? Councillor Callahan.
Yeah. Wait a minute, I'll put my glasses on. Clearly, any focus on our children's services is to be welcomed, but we need to be clear what we're actually getting here. Firstly, my understanding is the funding is not yet approved, and even if we get it, it's not going to replace services which aren't there. Children's assessments, speech and language services, paediatric services, they all have exceptionally long waiting lists, some of them up to 2 years, which I keep going on about. So even if we do get the proposed 833,000, it won't replace the lack of professionals that children and families in Nottinghamshire need to see. We are also very concerned about how much the level of need for these services could increase when we come out of COVID, and this funding will do very little to help us understand or address that. So I'd like us to be realistic about what this means and not to take our eye off the ball. We need to see more on how the implementation of family hubs will result in more access to the actual services that are currently in very short supply. As a rebranding exercise, clearly it won't meet the needs of children and families in Nottinghamshire. We have no guarantee of Nottinghamshire receiving this funding, but the issue is that services we are talking about, families being able to access, are very threadbare, and that this was the case even before COVID. So that's my question.
Thank you, Councillor Callahan. Councillor Carr, you indicated.
Don't know what you like to be called. I got in trouble at a meeting for calling somebody chair.
Chairman will do me just fine, thank you.
I'm actually glad that Councillor Girling's here today, because he can confirm what I'm about to tell you. At the last Economic Development and Asset Management Committee, I asked for a guarantee that the £1.1 million that's being spent on children's centres, were there any plans in the future to actually amend this? And the answer that I immediately got back was no. However, after a lot of shuffling and staring about from the Conservative benches, just 10 seconds later, the answer changed to not yet. So what is it? Is it no, or is it not yet? Between 2010 and 2021, over 1,500 children's centres have closed nationally. I have huge concerns that family hubs will be instead of, rather than in addition to, children's centres. I was referring to the annual spend of £1.1 million when I asked the question at the EDAM. I like that. I was going to name all committees after types of cheeses, but there we go, the EDAM meeting. You've already, as a council, axed 3 children's centres already. You told us that bricks and mortar weren't important, and you deliberately ran the services down in those 3 children's centres. You then used the lower attendance figures to justify axing the funding in Beeston, Huthwaite and Mansfield. At no point in this report, nor the appendices, does it even mention the current provision. The Conservatives on the County Council have previously said numerous times that children's centres would not close, but it is the firm belief of the Liberal Democrats and the Independent Alliance that the creation of family hubs will lead to wholesale closure of our children's centres. Whenever we talk about provision like that, and you said it to me in your reply to my question at full council, Councillor Taylor, or we hear that bricks and mortar are not important to delivering service. This is from the same council who are spending £15.7 million on a brand new council building at Topwick Hay Farm, Hucknall, and also spending £900,000 at Beeston Central to house social services. There is no information regarding the number of family hubs planned for each district. Yet you are asking councillors to vote to spend £130,000 on staffing new posts. So I repeat 2 questions. Can you guarantee that as part of this council's move to family hubs, no children's centre in its current location in Nottinghamshire will shut down for the lifetime of this administration? And secondly, with regards to Beeston North and Lenton Abbey's Children's Centre building and service, they are 100% funded by the County Council. Will you guarantee that this council will look to expand opportunities to use this building to safeguard its future? Thank you.
Thank you, Councillor Carr. I think Councillor Meakin indicated also.
Thank you, Chair. As Councillor Carr states, we feel that moving to a family hub would leave the wholesale closure of children's centres across Nottinghamshire. This includes the Kirby East Children's Centre based on the Summit Centre in Kirby Ashfield. We've seen it in Nottinghamshire City, where the Labour Council are proposing to close 2/3 of their children's centres to save money. This will undo all the previous good work of the last Labour government. It's no secret that the budget of this committee is spiralling out of control, but we feel that spending just over £1 million to keep children's centres open is a price worth paying. As a single parent, I myself have benefited from services provided to my daughter by our superb children's services. It's not just providing care, but they also place where children and parents can socialise alike. Any closure of any service leads to dramatic consequences for most vulnerable families in the county. Thank you.
Thank you, Councillor Meakin. Councillor Lee, I think you indicated also.
Chairman, thank you very much. It's an interesting one, this, because I've got experience working for this authority for the Family Intervention Project in Ashfield, in Mansfield, in Newark, in Boulderton and across. And we used these facilities, and when we used them, they were very underutilised. And this was in 2008. They were very underutilised then. And the wastage under the Labour administration then was ridiculous. And I worked for a department where I saw a massive amount of wastage in this authority. And that's the reason why I wanted to become a county councillor and get involved in politics. Leading on to that, my little boy has speech therapy, where his service that he provides has massively changed since COVID. He wasn't waiting 2 years, he was waiting maybe 3 months. And the service has dramatically changed, but what we've found is they're now working directly with the school, they know We don't have to take him out of school to take him down there. They're now working with him directly, working with him from home, and we're actually finding that his speech is improving massively under the new system than the old system. And I would say from my experience of working for this authority that we found that working directly with families from home and working directly with families where they feel comfortable, we got better work with them and got a better final outcome from my personal experience, Chairman.
Thank you, Councillor Lee. And Councillor Girling, I think.
Yeah, thank you very much, Chairman. Let me just clarify something first of all from Councillor Carr. I didn't say not yet. What I actually said was things change, so we can never say never. That's what I actually said. So I didn't say not yet. That was my point. Okay. So yeah, we're not going to reduce the spending on children's centres. However, we don't know how those services are going to be delivered in the future. It's the same way in which Sure Start centres were set up. The service was being delivered in a certain way, and then it came up with an idea for Sure Start centres. So therefore, what was being done before ceased, and it was being delivered in a different way. I was actually very fortunate, Chairman, because when I became a county councillor the first time, yeah, it was Labour were running this administration. I was brand new to politics, to be fair. The first time I even voted, my name was on the actual ballot paper because I didn't vote for anybody because I never bothered. And I got involved with 2 Sure Start centres in Newark. One was actually just outside my divisional area, but I was asked to go there because at the time when it was being set up, I turned up and started to get engaged with the people, because if you all remember how it started for those that were there, it was all post-it notes. What do you want your services to provide? And I learnt an amazing amount of information on what the public expected and wanted. Now, I created like mad at the Labour administration because on Hortonville, the largest council estate in Nottinghamshire, we weren't getting a building. We weren't getting a Sure Start building. We were getting the services delivered in that area. Now, we've since got one, but at that time, we were not getting a building. Whereas the Bridge Ward, actually that was then Vincent Dobson's, Councillor Vincent Dobson's patch, yeah, they were getting a brand spanking new building, and I was not happy. However, I ended up on the management board of both children's centres. Actually, I ended up chairing them. And I was immensely proud on how the services were delivered, both in the Bridge Ward in a building, but more importantly, not in a building, in the Hortonville estate. Because what that did, that brought other community groups together to deliver those services. We worked very closely with the school, the primary schools on Hortonville. We worked very closely with the children, with the community centres and all sorts of different places to deliver those services. So, my view, based on my experience, is actually it's not about buildings. However, sometimes we do need to have buildings. And I'll give you an example of that where, as Conservatives, we took control and there was a building delivering children's services called the Big House, which absolutely was a disgrace and not fit for purpose. We took it over, built them a new Big House and got rid of the other one, because the service that was being delivered was great, but it could be delivered better by that particular building being somewhere else. So yes, sometimes it is the building helps the services, but absolutely the services are the most important thing. Buildings do not deliver services. People deliver services, and that's what this is all about. And this is all about bringing it all together, because when children's centres first started, it was, I think it was 0 to 3 or something. It was very, whatever age it was very, very narrow. And it's since got extended and extended. This is about 0 to 19, I think. 0 to 19. But it's everything. This is going to bring in all the other partners that deliver services. So if you've got a 16-year-old that's got a drug problem, if you've got a 17 or 18-year-old that's got an alcohol problem, this is all about delivering the services to help them get rid of that problem. And that, to me, is what this is all about. It's about looking at what children's centres or Sure Start centres did, which was good. It's looked at what they've done, which has been wasteful. It's been lots of one where there's other groups and parties doing the same thing, delivering the same service, so it's not efficient. And it's saying, actually, look, let's do it like this. It's not rebranding. Government will always call it something different, always. No matter what party's in control, they always call it something different because it's this, look what we've done. That's politics. But this, to me, is about the service it's going to provide. It's about actually opening out and going, here you go, this is here. You've all got somewhere to come. We're going to deliver it where it's best being delivered. Not necessarily in a building, but if it needs to be in a building, that's what will happen. And that's what my job on EDAM, yes, I'm the big cheese, yeah, they'll come to me and say, Keith, we've got this service where we need a building. Yeah, where we need a building. And it might not be where there's a Sure Start centre. It might be where it's actually needed. And if we can facilitate that as the EDAM committee, that's what we will do. Because that's what's best for them out there, not for any other reason. So that's why I'm going to support this paper.
Thank you, Councillor Girling. Councillor Welsh, you had a question.
Yeah, I do. As someone who set up one of the first children's centre in Derby, I perhaps come from a bit of a different perspective from Councillor Girling. My issue remains that sometimes buildings do make a difference, and they certainly did on the Mackworth estate in Derby when they had that brand new building there. It had an enormous impact and continues to have an enormous impact on that estate. When working in children's centres, there was an enormous investment in the services, which is exactly what Keith Girling has said about. It is about the services. My worry is from this paper and from this concern that those services either aren't there at the moment, and I'll tell you why I think they're not there. They're either not there, or there's no clear indication from the government as to how we're going to establish these further services that are required. And I'll tell you why they weren't there. Because when I worked in children's centres and was part of a national initiative to bring women and babies in and do things on healthy eating, women's support, to tackle postnatal depression, literacy, numeracy, singing, all of this to help with regards to early years, it was a massive programme. Was it always successful? Did it always get the right people in? No, but it was a huge, huge programme. What is available today as someone that has a baby in Nottinghamshire are the majority of people in my group have had zero input from any children's centre across Nottinghamshire because the criteria is so closed. And I've talked about this again and again and again. Post-pandemic support and pandemic support via children's centres or family hubs or whatever we need to see needs to change. And we need that extra investment in those services to support children. You all may know something that I don't know with regards to we're going to get some more funding to actually deliver these services. But from what I can read from the report, and this is all that I can repeat, this money is about changing how we work. It's not about delivering any additional services. It's not about saying to all those women that have had babies during the lockdown, we're going to do health checks on all your babies because you've not been seen for the whole time. It's not saying any of that. So that's my genuine concern. And this is about reality and what people are saying is happening. Those services that were there before have ultimately disappeared. It's not, it's not just me that says this. The Institute of Fiscal Studies between 2010 and 2019 shows that children's centres funding reduced from 1.2 billion to 0.6 billion, and more than 1,000 Sure Start centres across the country closed. Now, I think we've done, credit where credit's due in Nottinghamshire, I think we've done a really good job in trying to keep our children's centres going. And I commend this council for that, because I do think it's really important. But are the services there? That's what I would ask, because I couldn't access any services when I had postnatal depression at the children's centres because I didn't fit the criteria. I would say this investment is, with regards to this report, I think we're going on to the next level with regards to what those services are. We haven't got this money at the moment, and that's the other thing that I wanted to just raise. I'm getting a little bit tired of local authorities having to fight for individual bits of funding from the government. You know, if we're all saying here that family hubs are important, they're important not only here in Nottinghamshire, about the country, we shouldn't have to bid for it. Should be a blanket approach across the country. And I'm not saying every local authority gets some funding, gets the same amount, but there should be a criteria there that Nottinghamshire can tap into. We're reading the report, and again, we might know that we're already getting it. Someone might know, but we're not even sure that we're going to get this money anyway, and yet we're saying how absolutely fabulous these family hubs are when we're not even sure that we're getting the money, are we? So we're talking about these fabulous services. A lot of them don't exist anymore. We're talking about new buildings in areas when we've already got children's centres that are underutilised. And my main point here is these are not a substitute for the Sure Start centres, and I don't actually think the government is trying to replicate children's centres, because actually I think the needs are different now. I don't think we should go back to exactly what the children's centres are, but I do think there needs to be an urgent review on what actually is being provided, because if we think that children's centres are providing the services that meet the parents' needs and children in Nottinghamshire, they're not. They're not at all. They might be meeting the needs of a very small minority, but they're not meeting the needs of many, many women and many babies in Nottinghamshire. And I keep raising it, and I will keep raising it, because I feel really disappointed. I know there was some additional funding, but the women that are in my group, there's 80 members of that group now. Some of them are very, very vulnerable, and they just cannot get the support they need. I think this is a bit like a bit of smoke and mirrors, really, to be honest, and it's a bit of a sticking plaster over the problems that really exist.
Thank you, Councillor Welsh. Councillor Carr, I think you indicated, and then Councillor Callahan. I beg your pardon, Councillor Callahan, you first. Thank you. Very gentlemanly, Councillor Carr. Thank you.
I think years ago when Sure Starts were set up, a lot of it was for universal services. I think, unfortunately, we've moved away from universal services, so the criteria is for targeted services. However, there is still a lot of families that need universal services. And Councillor Girling, I worked in Hortonville Children's Centre many years ago, and actually we did need a building for the programmes that we were delivering. So the parent-child game, you did need the videos, you did need the rooms, and without them, that service, which cost hundreds of thousands of pounds, has diminished. So a lot of things you can take out into the community, a lot of things you can't. You do need buildings. And coming back to Councillor Lee, when the FIP intervention was set up, I was part of that. I was took on as their parenting practitioner. And I worked in Sure Start Children's Centres, and we had collaborative working, delivering lots of parenting programmes and seeing families both in the community, in the centres, and in other areas as well. We've lost all of that, and I think it's a little bit deja vu when I'm looking at this, because we seem to be getting back to some of this, but there's not the funding for this.
Thank you, Councillor Callahan. Councillor Carr, did you wish to speak?
Yeah, I'm not going to get into this banter that my council estate's bigger than yours, but yeah, the estate where my children's centre, that was originally a Sure Start centre, is actually shared by the city and the county, and originally that's how the Sure Start centre was turned up, which is why it's called Beeston North and Lenton Abbey. But I've listened today, and this attempt to rewrite history with regards to Sure Start centres, I would say, and my goodness me, there were some faults in the Blair government, but I would say that was probably the best achievement of that government was the Sure Start centres. Yeah. And that's what we should be keeping. It's all right saying, and I think you said it, Councillor Girling, somewhere to go to. Well, if they haven't got somewhere to go to, i.e. a building, then where do they go to? But, you know, we wait to see that. But what does concern me is appendix, the wording at the top of appendix 1. Local organisation and teams signed up to the joint delivery of family hub networks in Nottinghamshire. And on there, at the top, is districts and borough councils. Well, Broxtowe haven't signed up to the joint delivery of family hub networks. Ashfield haven't signed up to the joint delivery of family hub networks. Their only involvement to date has been a task and finish group to map out what services there are in the county. And that's ended. Broxtowe have had no contact since that task and finish group at all. If you move to the next page, appendix 2, at the bottom, housing advice and support. Well, the districts and the boroughs are the housing authorities for both private sector and for public sector social housing. Housing department at Broxtowe haven't been consulted about how that's going to be delivered in the family hub network. And also, I understand, and perhaps you can confirm, deny or confirm this, that as at December, 3 of the most important children's services are yet to be engaged. And I can list them. Schools, pretty fundamental, child and adolescent mental health services, and special education needs and disability services. So you're asking us to vote for an increase in funding for posts when we have yet to address those 3 very, very important issues. You're claiming that the boroughs and the districts are signed up to this when they're clearly not. So what is it? What are we actually voting for? So we're voting for something that's going to commit the districts and the boroughs to something that you've not actually consulted them about. It just doesn't make sense to me.
Thank you, Councillor Carr. We've had an awful lot of questions and an awful lot of discussion. Because of who's crafted what within the paper, I'm going to ask Irene to actually speak on the project of the family hubs, where we are in it. So obviously, Irene, I don't want you to go into some of the history of the Sure Starts or what we're doing with buildings and things like that. If you can just articulate for us where we are with the Family Hubs programme, what we hope for it to achieve and with what partners in Nottinghamshire. If you can add any specific commentary on Councillor Carr's last question, that would be helpful. You may not have that information at the moment, I don't know. So if I can ask you just to frame something around this paper, what we want to do with family hubs in Nottinghamshire, I'd be grateful. Thank you.
children's centre service delivering family hubs. They are one of many partners in the whole development of family hubs locally. I've been to a number of national events and conferences about family hubs, and actually the big thing that goes in our favour locally is the partnership work. When you speak to other local authority areas and you say, what is the learning from your work that you've done to develop family hubs, the first thing everybody says is getting partners on board early. So we have recently met with the CAMS Commissioner as well about getting them on board. So we are doing everything we can. The other thing to say about family hubs is they're very local and they're based on networks. Those networks will be a main building in the centre that's open Monday to Friday, longer opening hours than children's centres, including weekends where needed. But it's about the local partners in the area, and that network could include the library, citizens' advice, it could include a virtual programme, it includes virtual websites and information. Those of you that have yet to see the Relationships Really Matters information on Not Help Yourself, that is such a good tool. It's got loads of videos for parents. So we're asking people, have a look at what's available virtually for universal provision. If you still need support, you contact us and we will offer that support to you. Best Start for Life is also a key priority within the Family Hub model. So we are retaining the services for under 5s from pregnancy to the age of 4. That will still happen and that will still be part of the Family Hub model. The Children's Centre service will be delivering that element of work alongside health visitors and midwives. No, I won't go into that bit. The focus of Family Hubs is very much about Tier 2 and early help services. This should be to try and reduce the demands on the specialist services that have those long waiting lists. So as an example, if there is a service with a very long waiting list, it could be for adult mental health services, then the Family Hub needs to support that family while they're on the waiting list. That doesn't happen now, and that will be happening with the Family Hub model. As somebody who's been involved in children's centres for quite a long time, I'm extremely excited about this. We're going to have a lot more services brought under the umbrella of Family Hubs, which means that they'll be talking to each other, working together, having team around the family meetings, and making sure that there's a far more coherent approach for families, including how they access services in the first place. I think if somebody does have, if there is a family with emerging needs, they are the target group for Family Hubs. We're not talking about very specialist services, although those specialist services could use a range of the network providers. That could be the library as a spoke. It could be the Children's Centre building. So the Retford example, the Children's Centre building will be the main hub. But I've got to, the issue around spokes, we're not asking other partners to be doing a lot more work. We're just asking them to work together, far closely together. That could include homelessness. So somebody comes in, phones up the early help unit and says, I'm worried about my homelessness situation, I'm about to be evicted. Then the Family Hub needs to contact the district or borough council to support that family. Is that enough just as where we're up to now?
Yes, I think so. Thank you, Irene. Sorry, Lawrence, you wanted to comment also?
Yeah, thank you. Just very briefly, there was just a couple of things that I thought it was useful just to add clarity on. So the 1.1 million that's been mentioned is the property budget for children's centres. It's simply the money that pays for the upkeep of buildings. It is not for the running of children's centre services. So our children's centre services are targeted services for preschool children. The funding for that is around about £10 million, and that's been the similar amount for recent years, and there isn't any current proposition of changing that funding. So that £10 million is what we've used. It doesn't pay for services that the NHS are responsible for, so speech and language, community paediatrics, maternal mental health services. What we do have is an opportunity, I think, through Family Hubs to have further conversations about how we integrate some of those areas of health provision back into what we do better across that whole conception to 19 age group that we don't currently have, some of which might be building based, if that makes sense for communities, some of which we hope will be outreach and actually will be closer to communities and will reach out to those families that perhaps don't want to reach centre-based services. I also just wanted to pick up on the point around eligibility, because I'd be really interested to know about people that need a service and can't reach one, both to have a look at what we're doing currently and how we might make sure that those people can access services, but also so that we've got case studies as we move into family hubs of people who are in need, who are not currently getting what they need. So I'd be very welcome to hear about any case studies of people who are struggling to access services, so we can have a look at it in a contemporary way, but also have a look at what it means for the future as well.
Thank you, Lawrence. Councillor Girling, you wanted to add something?
Yeah, it's a clarification thing, really, from quite disturbed by what Councillor Carr said in terms of we've got on this report saying that the districts and boroughs are signed up to it, to be fair. And I just wondered from Irene and involvement in the workshops, have any of the boroughs and districts indicated that they do not support what we're trying to achieve in the family hubs? And how would you describe their involvement? Is it in a positive way, or they're just going through the motions?
Councillor Carr, would you allow Councillor
I'm
Girling?
entitled to ask a
Councillor
question.
Carr, would you be quiet, please? Thank you.
Yeah, I think that's a fair question, Chairman.
Councillor Carr, thank you. Irene, are you able to comment on whether we've had engagement with all of our district and borough partners, whether that's ongoing and whether you consider it to be positive? Thank you.
And it's a priority within the early help executive. On that early help executive, we have Hayley Barsby, the Chief Executive of Mansfield District Council. Having spoken to Hayley, we wanted to engage district and borough councils on the task and finish group, and I then wrote to each Chief Executive who nominated an officer to come and sit on the task and finish group. District councils were at the very first meeting. They have been absolutely critical to the work that we've been doing around family hubs. Every single one is there. We are doing some local work as well with them. We're having lots of one-to-one discussions with them outside of those meetings. The chief execs are aware and officers do attend those meetings. We're also engaging them through place-based partnerships, which are the new integrated care systems, and we're also getting buy-in there. If reports haven't gone to committees and so on, then that's something we will be doing with officers. We are still in early stages. So Retford Central being the first one, and you'll hear about that in the next paper, the district council is heavily involved in that one. And likewise, as we develop more family hub networks, we are then going to be doing some more work with the district and borough councils, who at the moment are telling us where the need is, where those priority areas are for them. So we're trying to prioritise those areas while making sure that our data is telling us where we need to be prioritising the rollout of family hub networks.
Thank you, Irene. Councillor Carr.
Sorry, I have to come back
keep it
on
relatively
that,
brief, please.
it's put the office in a really bad situation.
Councillor Carr, no, this is not putting officers in a bad situation. Irene has been quite clear that officers at the boroughs and districts are engaging well. Thank you.
Well, that's not the case. Can I just say, I've had an email here from the Chief Executive Officer at Broxtowe, who says that, if I can find it, districts are represented by one CEO on the Early Help Board. Nothing about this has been discussed by other district chief executive officers, and one from the service director at Broxtowe, who says, just for information, we were asked to attend a task and finish group to assist with mapping current services in the districts, but that's our only involvement. They're from officers at Broxtowe Council. It's very senior officers at Broxtowe Council. So there just seems to be, I'm an ex-banker, and when a cheque used to come in, and the figures and the words didn't match, I think we've got that situation here.
Councillor Carr, I'm going to hand over to Mr Pettigrew to respond. I'm also an ex-banker, sir, and I do know how the system works.
Thank you, Chairman, and if I may, as Corporate Director for Children's Services, if members need to challenge officers, then I think that's the purpose of Children and Young People's Committee. Yeah, I think I heard Councillor Carr saying that the district councils weren't cited on this and hadn't been involved. Yeah, I think Councillor Carr's just told me they have been cited on this. They have had some involvement. Yeah, Sorry, if I misunderstood Councillor Carr, I apologise. Yeah. Sorry, I thought earlier you were clear that they weren't cited on it and hadn't been involved. I must have misunderstood then in that case. Yeah, but I think that my officer, Irene, clarified that position. Yeah, I think you're both describing the same thing. Yeah, about an involvement in a family network and involvement in a meeting. Yeah, we're actually describing in this paper why we need capacity to do more of that, not less of it. Yeah, and I think the paper outlines the common agreement here. Yeah, we need to do more about engagement with partners. We need to get more partners involved. Yeah, but I certainly understand that through, and this is not unusual in two-tier authorities, that in major programmes we ask one district council who agrees to represent the rest of the district councils in strategic planning and consideration. Yeah, and I think Irene has outlined in this case, that's the chief executive from Mansfield, yeah, Hilly Barsby, yeah, and Irene has written to every chief executive of each district within the county to clarify the position and the progress to date. Yeah, I'm sorry, Councillor Carr, if you as a district councillor are not as cited that as you should be. Yeah, we can help with that. Yeah, but I'm sure that your chief executive can also help you with that too.
Thank you. I'm going to move this along. I just want to come back on a few of the comments that were raised, probably starting with Councillor Carr's earlier comment, and I think Councillor Meakins also referenced buildings, including the City Council's closures. It is not for me or this committee to comment on the performance of colleagues in another local authority. I think it is, however, fair to say that the City Council's proposal to close children's centres is not about simply an approach to the service. It is for other and more complex reasons. That is not the situation at this council, and we are not looking to close children's centres to save money or any other such thing. Councillor Carr, if you are going to quote me, please make sure you quote me accurately. At no point at full council did I say that bricks and mortar are not important. What I said is that buildings do not deliver services, people do. So if you are going to quote me, please be accurate, sir, because the definition or the nuances mean completely different things. Buildings are important if they serve a proper purpose for the service delivery for which they're intended. With the children's centres, we have said repeatedly, and you already seem to be falling somewhat under Councillor Hollis's delusions that we're closing all the buildings, there's no services anymore, and that it's only the buildings that can possibly deliver them. So we're really not going to pursue that particular debate. I'm grateful for the positive testimony that came from some colleagues about their experiences in other places, Councillors Girling and Lee, and Councillor Callahan, because of your first-hand experience in other places, and Councillor Welsh, not least yours has been in another county. I think it is important to recognise which services we are responsible for delivering within the partnership. And both Irene and Lawrence have mentioned some of the services which we do and do not deliver. I know that speech and language therapy services have been a hot topic of debate over several months in this chamber. It is not we who are responsible for delivering them. It is our partners in health who are. And whilst I quite agree that it is incumbent upon us to facilitate partnership working as best we can, it is not for us ultimately to be responsible for the delivery of services which are not in our gift or remit to deliver. So we are facilitators, and in many ways I think we're leaders. Coming back to the paper that is in front of you, this is about this council choosing and making a formal decision to increase capacity in order that we can move forward with the Family Hubs project, in order that we can better support families, children in Nottinghamshire from age 0 to 19, and we're not going to reprise the Sure Start debates either, because this is about supporting families now with the problems that they have now and under the models and initiatives that are available to us now. I'm grateful to officers for the work that they have done in bringing us thus far. I hope that we are going to agree the recommendations before us in a moment when I take it to the vote, and that will actually allow officers to progress with the bid so that we can secure some funding in order to take the work further forward. So with that said, and I think we have had more than enough debate on this matter, I'm going to take us to the vote now. All of those in favour? Thank you, colleagues. Those against? Do I have any abstentions? Okay.
Could I have a recorded vote, please, Chair?
Is a recorded vote appropriate at committee? Okay. Thank you. Can I ask the clerk to talk us through to record our votes? Thank you.
Thank you, Chairman. So this is a recorded vote for item 5. If you members could indicate if they're for, against or abstaining. Councillor Taylor.
For.
Councillor Anderson.
For.
Councillor Smith.
For.
Councillor Barney.
For.
Councillor Callahan.
All right. Against? I think you heard it anyway.
Councillor Carr.
Against.
Councillor Henshaw.
Against.
Councillor Girling.
For.
Councillor Lee.
For.
Councillor Meakin.
Against.
Councillor Welsh.
Against.
So, Chairman, that is 6 votes for and 5 against, so that's carried.
Thank you. Right. I think we've spent more than enough time on that paper. I have to say I'm very disappointed that colleagues don't feel able to support something which will actually move this council forward in another initiative. And I do hope that your decision on that paper does not colour your thinking and voting on the next paper, which is about a very specific facility in Retford. So this is agenda item 6. This is proposed changes to the Retford Central Children's Centre to become Retford Family Hub. You have one recommendation at page 37 of your papers, which I move.
And I second that, Chair.
Thank you, Councillor Anderson. Do we have any comments or observations on this paper, please? Councillor Welsh.
Oh, yes, it is. May I ask a question and then say something once I've had the answer, or will I not be allowed to speak for a second time? So I had a really important question about the last thing with regards to how they're identifying the need, and I did put my hand up, but I wasn't allowed to ask it.
I'm happy to take a question.
Okay.
I would actually like us to move along. I think I've been very generous with the debate so far.
Yeah, sure. Financial implications, paragraph 9. In a report to Finance Committee on the 22nd of November, it mentions financial implications relating to this care home of 1.9 million. Last week...
Councillor Welsh, we're on the item about the Retford Children's Centre.
Oh, sorry, I've skipped.
Yeah, thank you. Do I have any questions on item 6, the proposed changes to the Retford Children's Centre? Councillor Carr, thank you.
Thank you. Whilst Retford Children's Centres will turn into a family hub, which will safeguard its future, what assurance can you give that every other children's centre in Nottinghamshire will be treated the same as Retford?
Councillor Welsh, you do have a question on this paper.
Yes, it's with regards to this Retford family hub. Does it mean additional services will be delivered here? I know they're linking up with the maternity services. I think that's absolutely brilliant, and I feel really passionate about that there is that link there. And I do think that's when a building is really important, that women can go. but will it mean additional services in that area in light of the fact that child poverty is rising in that area, breastfeeding rates are declining, and there's significant government data with regards to the health issues in that area as well? So I'd be wondering whether there are any plans for additional services, or perhaps re-looking how we bring services together at that family hub, so to speak. And the other question I have, which does relate to the other paper as well, is how and this is a genuine question, and perhaps something that needs to come back, because it's a genuine interest, and I think we'd all be interested in this. Even Councillor Girling, who's on the biggest council estate in Nottinghamshire, is we talked about the districts and the boroughs helping to identify need and where that need was. It'd be really interesting to know what criteria and what they're doing with regards to identify that need. So I could sit here today and say, well, I think the most need is within my patch, and I suppose other councillors could as well. But is there going to be a criteria there, or is it borough councillors saying, oh, we've got a bit of a problem on that road, we've got a bit of a problem on that? I'm sure it's not being done like that, but having some clarity on that, I think, would help all of us understand as to how service delivery may look in the future.
Thank you, Councillor Welsh. And Councillor Girling, I think you indicated again.
Yes, thank you very much, Chairman. Services and the family hub, we've had the debate on whether or not we should go down the family hub route, and this is basically saying that we're going to sort of do it effectively, and so it's a clarification of my understanding, really, is what I'm looking for. Because if you look at the previous report, Appendix 1 and 2, yeah, it says all those people that have signed up. Maybe some district councils haven't, but we won't go back over that. But it also says then the network of consolidated existing services and interventions which may include. So my understanding then is Appendix 2 is the sort of services that we are going to be delivering from a hub, which, again, this is my understanding, so I'm asking for clarification, because I've not really been involved in children and young services for quite a long time, and also in Sure Start centres or Home Start services or any of that kind of thing. It is, to me, that looks like far more than is being delivered at the present time. So therefore, this is actually demonstrating the benefits of the hub, family hub, rather than a Sure Start centre. And therefore, actually, I don't know how you can vote for this if you voted against it happening in the first place, but I'm sure we'll get some different results here. But can you just clarify that actually then this is going to be delivering what some people have voted against?
Thank you, Councillor Girling. Would you switch your mic off? Sorry.
Yeah.
I believe that you are correct, that the number of partners, the breadth of services will be far more expansive, not least because we're looking at that 0 to 19 and we're looking at whole family work. But if I can just ask Irene to clarify that understanding, and then also speak specifically on what we'll be doing at the Retford hub. Councillor Welsh's questions about identifying needs and whether we can do objective assessments and what additional services are coming.
Absolutely. Yes, you were right, Councillor Girling, about Appendix 2 of the previous paper. These are the sorts of services and interventions that will be provided through the Family Hub network. A lot of it will happen in the main site in Retford Central, but again, a lot of it will happen within the spokes. We're doing quite a lot of mapping at the moment in Bassett Law, working. So we had a brilliant meeting last week, for example, with Citizens Advice, who have put us in touch with lots of small charities in the area that weren't on our radar. And that's the sort of local partnership that we're going to be doing to try and bring together services and interventions. So there might be a small charity doing a piece of work that we just don't know about. We found out about a young people's training programme the other day, and those young people can come and develop and renovate buildings and paint and decorate. They're learning a new skill, they're doing some volunteering work, and actually could really benefit and increase the ownership of family hubs. So it's those sorts of things that we're going to be looking at, the different available services. It will differ in each area, and that's where it comes to the different needs. There'll be a core offer, which is the majority of those services in Appendix 2, and there will be additional service provision or interventions depending on local need. So the data that we've looked at is child poverty data, income deprivation affecting children data, breastfeeding rates, low birth weight, health inequalities data, employment, you name it. We have a series of different data sources. We've pulled it all together and we're mapping at the moment where the areas of highest need are. It doesn't mean that that's the only locations that family hubs are going to be in. We still want to have family hub coverage across Nottinghamshire. Doesn't mean there's going to be buildings everywhere, but it's the services that are going to be across, so the home visiting, the virtual programmes and so on. But that work around needs has come from the data that we hold as a county council, but also talking to the place-based partnerships, which again, sorry, I keep going on about the health world and integrated care partnerships, and the district councils who already identified wards and estates within their areas that have a range of issues, including higher crime rates and so on. So we've matched that data together, and we are still in that stage now of looking at that to prioritise the rollout. So it's still early days.
Thank you, Irene. Any other questions or comments? So I will follow up with this one. I mean, it's really positive news for Retford. This is a building where we had previously had a children's centre. An early years provider came in and was operating there, but was not a viable business going forward. They withdrew that provision. Because of COVID, we have had maternity services specifically delivered from that building to keep them away from the Retford Hospital campus whilst there were risks of infection. So it was a safe and separate way of delivering services and help. And we have recently been through a full and proper consultation with the local community and stakeholders to establish how they would like that building to be best used to meet their needs. And the conclusion of that, or the feedback from that consultation, has been resoundingly as a family hub. Certainly for me as a Bassett Law representative, I'm very excited that we have a live site about to come forward. So have been prepping, and that was discussed in the previous paper, can actually go forward in real life, in real time, sooner than later. So I'm really pleased with this. So having said that, we have the recommendations on page 37. Can I have all of those in favour, please? Councillor Carr, I beg your pardon. You're talking about a specific assurance about all children's centre buildings. You have asked this question previously in a number of different guises and forms at a number of different committees and council meetings. You will get the same answer on each occasion, I am sure, that at any point in time, this council will use its assets, including its business, its buildings, in the most appropriate fashion and to meet the needs of service delivery. And that is the approach we will continue to take. Thank you, Councillor Carr. With that said, can I have a vote on this, please? All of those in favour?
Chairman, can I have a recorded vote, please?
Would somebody like to second that? All right, thank you. Can we go to a recorded vote again, please? Can we have no noises off, please? We have actually been in the chamber quite some time already, so if we could just carry on with conducting the business.
Thank you, Chairman. So recorded vote for agenda item 6. Councillor, if you could indicate if you're for, against or abstaining, please. Councillor Taylor.
For.
Councillor Anderson.
For.
Councillor Smith.
For.
Councillor Barney.
For.
Councillor Callahan. Councillor Carr. Councillor Henshaw.
For.
Councillor Girling.
For.
Councillor Lee.
For.
Councillor Meakin. Councillor Welsh.
For.
So that's 9 and 2 abstentions. Chairman, that's carried.
Thank you, and thank you, colleagues. Thank you for your work, Irene, and colleagues. You know, we just need to crack on with this one now. I think it will bring huge benefits for the families using that particular facility in Retford. If we can move on to item 7 of the agenda papers, which is a report on children's home provision. There are 2 recommendations on page 43 of your papers, which I move. Do I have a seconder, please?
I second those, Chair, and I'd like to speak on this matter now, please.
Thank you, Councillor Henderson.
Minster View is a home for children with learning difficulties in Southwell. Was temporarily closed in November last year as a consequence of concerns about the quality of practice in the home, combined with the significant ongoing staff shortages as a consequence of the pandemic. It is the view of senior officers at the time that it would have been unsafe to keep the home open. This was a very difficult decision to make and sadly resulted in 5 children from Minster View being transitioned into alternative homes with the support of Minster View staff. Today's report explains that the current building, an ex-isolation hospital on the site of the National Trust Workhouse, has an institutional feel at odds with a homely atmosphere that children should experience. The report goes on to explain that the structure and size of the building limits effective managerial oversight, and that with a capacity of 12 bedrooms, the current building is far larger than it is considered optimal for a modern-day children's home. The report also notes that due to improvements in the support of families to the community, Minster View has been operating below capacity for some years. Today's report recommends replacing Minster View with smaller children's homes or homes for up to 4 children with severe learning disabilities and complex behaviours. More information about the replacement provision will be provided in a further committee report that will be available in January. Thank you, Chair.
Thank you, Councillor Anderson. Councillor Lee, you indicated.
Chairman, thank you very much. I think what I'm going to ask has already been answered, but I'll ask it anyway. And what's changed? In the past, we've said one thing on this site, and now we're saying another. What has changed, Chairman?
Thank you, Councillor Lee. I'll take Councillor Welsh's question and then we'll respond. Thank you.
Hi. Firstly, I'm just going to talk a little bit about the staff shortages that you spoke about. I may have not read this report correctly, but I can't see that mentioned within here. Instead, rather than being staff shortages, actually what it says under HR implications with regards to staffing is just that they're previously working at Minster View, who remain within the local authority, have taken up roles either temporarily or permanently. So there seems to be a bit of discrepancy between what's being said and what's in the report. And then we'll move to financial implications. As I said under a previous report, which I shouldn't have said because I made a mistake, in the Finance Committee of November 22nd, there were financial implications that were laid out with regards to Minster View, which alluded to, well, didn't allude to, it said very specifically of 1.9 million. There's since been a finance briefing that went out to finance members last week that then said that it was 2.1 million. And in the financial implications in here, we have neither of those figures. So I think it's really important we're clear, one, on what exactly is the staffing issues and what has happened. I think we all realise how important it is as a local authority that we're very open about what happens in our care homes. Very open about what happens in our care homes, and to have what is touched on there not actually in the report actually slightly worries me a little. And I would like some clarity, and you will have to forgive me because too many sleepless nights with a little one means I have to write things down, so apologies for the next bit. I've done my password.
If it's any consolation, they get bigger, but you don't sleep any
Oh
better.
yeah, that's what no one says. This is it for life. So those are the two of the things that aren't in the report that I would like to see. The other thing I wanted to talk about is the recommendations. And as someone who's lived and breathed reports to committees, both at here and at various other levels, I'm quite surprised that these recommendations got anywhere, to be honest. Because you want us to vote for something where we don't necessarily know what care or how you're going to deliver the care for those children once this is closed, and instead it's going to come to a different report. I think you probably understand that's quite hard for us as members, well, as me as a particular member, to vote on when we don't, if you're going to close something, you know, where are those children now? And obviously not the exact, but what kind of provision are they in now, and where will they be in the future, and what is the council's plan post this? Because we've talked about financial implications, but we've also in the past talked about how expensive it is, and it's not all about cost and expense. The children's care is the most vital thing, but I think we just need to be really clear with regard to that. And recommendation 2 in a committee paper agrees to receive a detailed proposal on the development of the children's residential estate at the next committee meeting. When I asked about the building, there was a bit of confusion as to what could or couldn't be done with that building, because of its close proximity to the workhouse in Southall. What is going to happen to this building? And will Councillor Girling have an ongoing issue in the budget with regards to maintaining that budget? From his budget with regards to maintaining that building to a certain level? My understanding is you can't make changes to the building, and I'm not sure whether it can be knocked down as such. I know there are certain it's not listed, but it's another protection with regards to it. I feel that there is not enough information in this report, or there's too many questions of things that have verbally been said that are not down in this report. And because it does relate to a care home, where I think it is vitally important, given the history, that we are very, very open about what happens in our care homes, for what reason and why, I'm asking that this report is deferred, so that not only as members, but members of the public can actually get a clear picture of what has been happening at Minster View, what the financial implications are, what those staffing issues are, and whether there is a staffing shortage, or we've had lots of staff that have gone to work elsewhere. I would like to see more transparency regarding this. I'd like reassurances and clarity about the interim support for those children and how they're being cared for. And I'd really like to know what the plan is for the council provided residential places for our children with complex needs in the future. So while there may be 5 now, what happens if another child moves into Nottinghamshire next week that has these complex needs? Where will that person go, and how will we deal with that? This report, HR implications and financial implications are a legal obligation in reports, whatever level of reports you have, whether it's local government, whether it's in the Houses of Parliament. Now, either those other reports at the Finance Committee are incorrect, or this report is incorrect. The same for the HR implications and the financial implications. I'm really concerned about the level of this report and the information that is missing, and I'm not actually playing with this, because actually this is something, the care of children is something I feel passionately about. But I personally, from the background that I'm from and the work that I do at various levels, I feel very, very uncomfortable in voting for this report in the way that it stands at the moment. I feel we have an obligation to elected members and to the public to be far more open about what is going on and to actually include the facts. I don't think we should be missing out something like 1.9 million or 2.1 million out of the report. I think that's pretty appalling, to be honest.
Thank you, Councillor Welsh. I'm going to ask Mr Pettigrew to come in first and then Mr Edwards.
Thank you, Chairman. I'm going to cover the issue that Councillor Welsh raises about the Finance Committee first. Yeah, at a relatively high level. Yeah, Lawrence will be able to go into it in some detail. Yeah, but I've pulled up the committee report, Councillor Welsh, and I'll refer to paragraphs 11 to 13, which are the paragraphs I think that you're referring to. Yeah, so it talks about children and young people's £2.2 million overspend, of which 0.3 million is in Steve Edwards' area, Youth, Families and Social Work Division, a forecast of an overspend of 0.3 million. Yeah, and then a forecast overspend of 1.9 million, which is in Lawrence Jones' division. Yeah, now I'll read out the paragraph for absolute clarity, if I may. Yeah, because I think you may not have understood what the paragraph's saying with respect. The Commissioning and Resources Division, Lawrence Jones's division, yeah, which commissions services not for 5 children, but 1,000 looked after children. Yeah, the Commissioning and Resources Division is forecasting an overspend of 1.9 million, which relates to a forecast overspend of external looked after children placement costs and the additional costs of children transferred from Minster View, which is temporarily closed, offset by a reduction in children's centres costs in other budgets. Yeah. So the 1.9 million refers to the overspend for all looked after children, all 1,000 looked after children who are placed in external placements. An additional contribution to that 1.9 million were the 5 individual children from Minster View. Yeah. So if that report has misled anyone to think that the costs of Minster View is a £1.9 million overspend looked after children's budget, then that's not the case. I hope that clarifies that matter. Yeah, I think Lawrence and Steve can probably deal with the detail.
Thank you. Steve or Lawrence, which of you would like to speak first?
If I start by answering Councillor Lee's question about what's changed. Well, there are a number of things that have changed. Minster View's been children's home for many years. And during that time, 2 things have happened. The first thing that happened, we've got much better at providing community-based resources for children with learning difficulties. So less children actually need the provision. And Minster View's been well below its maximum capacity for many, many years because of the excellent work that people are doing sort of in the community. Second point is it's an old isolation hospital. You know, it's not within the community. It's based next to the workhouse, and it has got a very institutional feel. You know, rooms off, long corridors. It's not homely at all. It does make supervision of the children more difficult because of the size of it. So that's why things have changed, and nationally as well as locally. We're looking to place children in smaller family homes. So it is felt that the future of Minster View and the children that need a resource like Minster View are better placed in smaller provision. So that's the reason for the change. To come on to Councillor Welch's questions, I think in the first paragraph of the report, it does say that the staffing issues caused by the pandemic, sort of right on the 5th line down. So at one point in this time last year, just before this, there were, I think, 14 staff off with either had COVID or were self-isolating because of COVID. That's a massive proportion. You know, the manager had to self-isolate at home. There were concerns about practice there. And, you know, it's my decision in the end that it wasn't really safe for those 5 children to stay there. It was really, really difficult decision to make, and not a decision that was made lightly. But the staff at Minster View worked with those children, and we did find new homes for those children, temporary homes for those children. Some of those children, are really settled in those new homes. Some of the staff at Minster View actually were deployed then when the children had left in supporting those children sort of into the new homes. Since the children have been settled in the new homes, they've worked in the other parts of our residential estate. It was the Minster View staff that came to the rescue of a fostering couple who had a 15-year-old foster care child with them who's got significant learning difficulties. He bites and he scratches. He'd been tested positive for COVID. His foster carers, who were elderly in the 60s, both had COVID. The foster carer had to go into hospital. It was the Minster View staff that set up a temporary home for that child and looked after him whilst he was positive with COVID. They did an absolutely sort of fantastic job of supporting him. So what we're doing now is actually wanting to meet the needs of those children that do need that support in a much, much better way. And you can see in the report that it does say now that for children with learning difficulties, the cost in the market and the homes that those children went to, I think it says, is comparable and is of a good standard. So, yeah, that's the sort of logic behind it. It was a really difficult decision. I feel really, really sorry for those children that had to move last year. My view was that it wasn't safe for them to do so. I met with the parents and I really apologise for the inconvenience that's caused. But I think now that moving forward, actually, there's a chance for those children and future children to have even better support from the County Council.
Thank you. Lawrence, was there anything you wanted to add?
I'll just pick up quickly on some of the points around finance property and kind of the future plans. So the budget for the home itself is just below 1.7 million, as is in the report. There are other corporate costs associated with it that, of course, don't fall within this committee's purview, but they're kind of dealt with elsewhere. So whilst there is sometimes other figures used, and I appreciate that Colin's explained figures more widely that weren't attributable directly to the house, there are other numbers sometimes used because of those corporate costs. So just to explain that, but the running budget of the home available to the department is just below 1.7 million. In terms of the property itself, we've fully consulted with property colleagues around the proposed disposal of the property. That won't be a matter for this committee. I think as officers and people who are responsible for trying to make the best proposals regarding the good care of children, the fact that we have a property that's inappropriate, we can't continue to suggest that that's used in place of what would be smaller homes that would be like family homes, which it has to be said, Minster View is just simply not. It is not a family home, and it's not a place where you would want children to be and to grow up. And their children in the care of the local authority. So I think it's really important actually that we don't put children back into a setting that we really don't feel is most appropriate. We've already got permissions from Policy Committee for the purchase of a further number of small homes. So in principle, it's agreed that we'll purchase more small homes. We've also got an estate already within the local authority. And what we want to do during this next period is just to work through what the best configuration is of the properties that we've got for the needs of children, and what staffing looks like to be the best it can be in order to provide the best services that we can for those children. Because the Minster View staffing establishment obviously will have to change, but it will be converted into staffing elsewhere for other properties, which may look different because the number of children in them will be different. So we need to do that piece of work before next committee, with the knowledge that Minster View won't stay open. It would be presumptuous of us to have done that detailed work with staff and trade unions ahead of a decision that the home wasn't going to reopen.
Thank you, Lawrence. Councillor Henshaw.
Thank you to the officers for the information. Nevertheless, Mr. Edwards mentioned that he had concerns about practice. Was that in relation to staffing or just in relation to the physical confines of a sort of an outdated service? Because someone that was involved in the redeployment of people when the long stay institutions such as Balderton closed down, obviously we made sure that from a big institution people went into a more appropriate smaller service. But what happened was, if you didn't have the individual right at the centre of everything that you do, then what happens is you move from a large institution, working practices don't change so much, and you end up with a small institution. And I think this is the whole issue that we need to look at in relation to the children's services that we provide as a council, because I understand that we need to move into more smaller, person-centred, individual packages that reflect. I mean, it mentions in the report that people's support plans weren't actually affected because obviously people have moved on. But as my experience is, people's support plans are affected unless they are reviewed extensively and regularly and improved not only from the individual's perspective but from how we work as an organisation. So I just wonder if by closing a large institution or a large service, moving into these smaller pockets that you mentioned, we have the progression and staff training to ensure that they don't become institutions in that right. And the other thing is, you mentioned that the children have learning difficulties. Have they learning behavioural difficulties, or do they have a learning disability that's obviously more complex and with them for life?
Thank you.
Well, I'll answer that first question first. They have very severe learning difficulties that we will be with them for life. Second point I'd make about staff and staff performance, and this doesn't just relate to Minster View, but obviously when you're responsible for dealing with some of the most vulnerable children in Nottinghamshire, you want the staff to be performing to the absolute best standards. And across the whole of the residential estate, I'm not talking specifically about Minster View now, and I don't want to get involved in individual Pilbara. I want this committee to be reassured that we do take action on staff, disciplinary action when it's required, and we have ongoing training for staff, because what we want is our staff to be of the highest possible standard, and when people fall below that standard, we support them to get there, and occasionally have to take disciplinary action in unusual circumstances. And I think you heard before as well that I talked about how proud I was of those Minster View staff that rallied round and supported a young person who was severely ill, and his foster carers who were also severely ill at a very difficult situation.
Thank you, Mr. Edwards. Councillor Girling and then Councillor Barney, thank you.
Yeah, thank you, Chair. First of all, I want to start off with the complaint. I really object, and I really object to being referred to as elderly because I'm in my 60s. Right, so let's get that straight right from the beginning. I'm not elderly in any way, shape or form. And I think, but joking aside, I think that the things that stuck out to me, particularly in terms of what some of the officers have said, is safe. Yeah, and that is our primary concern, is to make sure these children are safe. Now, I don't know, I mean, there's some statesman here that's been councillors a very long time. I don't know if they've actually been to Minster View, but when I was a county councillor last time, I have. And I had been there, and it was at a time actually when it was being run and it was all going really well and all sorts of things like that. And it was quite clear then, and so this would be 2009-ish, I think, somewhere around there, that it's weren't a brilliant place. It wasn't a brilliant place, but the services were being run, and that. And this, what's happened with COVID, it's pushed out a lot of opportunities as well as challenges, and I think it's given us the opportunity to look at the services that we are providing, and is it the best place for that to happen? Clearly, Minster View isn't. It just isn't. I wouldn't want my disabled child to be in that facility, no matter how good the service is. And this brings me back to my point I was making earlier. It's about service delivery, not the building. But when the building is required, then that's what we have to do. Yeah, and this is a building that's not required, so we have to do something about it. And this is what we're doing. You know, and get rid of another myth. As a Conservative, I really care, you know. I absolutely really care about the people in Nottinghamshire, the children in Nottingham, and the vulnerable people in Nottinghamshire. Absolutely. That's one of the reasons I'm sat here as a councillor. In terms of the building, I think Steve said about the fact that, you know, it's Lawrence, wasn't it? But it was presumptuous to decide what was going to happen to that building until it's been decided exactly what we're doing with that service, which is today. However, I have had the officers look at the property to see what we could possibly do with it. And like any other building that we own as a council, and any bit of land that we own as a council, we will look at the best way to use that. Now, that might be by delivering other council services from there, but it might not. But we'll do a proper assessment, and then we'll decide what will be best for this council in terms of that particular property and where it is. So please be assured of that. The officers will be starting on that today, and we'll be either putting other services in there, disposing of it for whatever reason, demolishing it and building on it, or renting it out. We will do what's best for this council in terms of what's there. But to me, this is all about the service delivery. Those children are now getting a better service in the area that that service is being delivered, and it, to me, seems a far greater way of going about it. So once you've been able to telling off, you know, and apologise to me on email, I'll accept your apology. But yeah, I think this is the right thing to do, Chairman, and I fully support it.
Thank you, Councillor Girling. Councillor Barney.
Thank you, Chairman, and thank you, Councillor Girling, as well, for your comments. I actually wanted to just speak personally. I've not said anything so far in this meeting, but it's interesting for me to be part of this committee because I cannot disattach myself from my own life experience and my own family's involvement with the care systems over many decades, and my own foster and adoptive siblings. And I just wanted to touch on that just briefly because there's been twice in this meeting that I felt very moved, and both times have been when you've spoken, Mr. Edwards. Your compassion and your humanity has resonated with me, and you've taken me back to moments in my own childhood, thinking about the arrival of foster kids and very vulnerable young people arriving in our own home setting for the first time. I'd just like to applaud the work you're doing. It's wonderful that we've touched right at the beginning of this meeting that the adoption times are reducing so significantly. Children are spending less time in care. You're getting those placements sorted out so rapidly. It's absolutely fantastic, and I felt your compassion when you spoke about that. But also on this centre, I haven't visited Minster View, but I have heard others that have. And from where I'm sitting, my wife actually is a clinical psychotherapist, and she works with looked after children, or severely autistic children. And I know that environment is all so important, and in her own experience, everything you're talking about is the way the systems that she's involved with are going, working much more personally, much more tailored on a one-to-one approach. And if we think how things have changed from when these children just a few years ago were institutionalised and locked up virtually in prisons, to the middle of the road establishments, which I suspect Minster View was built around, which were a bit of a halfway house, and to where we're now at, we're travelling in the right trajectory. So to my mind, the sooner this institution is closed, and there's no threat at all that these dear autistic children can be placed back in there, and that they continue to be placed in the settings and environments you're putting them, the better. And so for that reason, I have no qualms at all about supporting this, and I want to thank you for your compassion and humanity, and may it continue. Thank you.
Thank you, Councillor Barney. I think if I can just reprise on a few things, I think officers have answered the questions raised, specifically over finances, staff shortages. I was looking back through the papers as Councillor Welsh was articulating her questions over staffing, and I can see how what's in the paper might have been confusing. I've had the benefit of a lot of conversations about this matter and officer briefings. I know that opposition members are afforded opportunities for briefings. I don't know if you've been able to take them up, but paragraph 2 does read that it was closed temporarily in November last year following staffing issues. I understand that very brief language to mean that we were short-staffed for a number of reasons within the pandemic. And then when we go on to the HR implications, and it talks about staff from the Minsterview establishment having been redeployed in other roles during the pandemic and during Minsterview's closure, I understand that because of the benefit of the briefings I've had. I hope now, with the benefit of those conversations in the meeting today, that you are also fully understanding of what's been going on. In terms of the finances, Mr. Pettigrew explained how presentation of figures in reports in different places can throw a different complexion on what's been going on here. And I think Lawrence certainly spoke about, well, both Lawrence and Steve spoke about the costs of homing children in Minsterview or elsewhere. And the fact is, for the last 12, 13 months, these 5 young people have been homed elsewhere. And the costs have not been significantly different. I mean, I'm not giving away any state secrets if I do a very crude calculation that on the basis of the fixed running costs that have been articulated, the 1.7 million, on a building that was staffed for 7 children, had it been full with 7 children, each placement would have been costing this council £285,000 a year. It was actually running at 5 out of 7 occupancy, which makes those costs £400,000 a year. And from the figures that you've seen in other papers, that the 1.2 million of placing 4 children in external placements, that's £300,000 per child. So you can see that the numbers are in the same ballpark. We're not overspending in the private market. More significantly for me, though, those young people have been elsewhere for 12 months. You know, we haven't just moved the furniture out while we fixed a leaky roof. 5 lives have moved and settled in other places. So were we to open the doors of Minsterview again today, I would have to ask the question of this committee, would you be choosing to simply move those 5 young people back into the building when they have lives settled and established elsewhere? So there's that dilemma in those terms. In addition to that, Councillor Welsh asked a question about what happens when another young person with these kind of complex needs comes into Nottinghamshire. Where will we find the place? At the moment, we as a council have a building that could offer 5 places. We consider it to be wholly unsuitable for the delivery of best services to anyone coming in. It is not serving its purpose. It is not fit for purpose. And we would be faced with asking Mr. Jones to procure a place in the market for that young person to best meet their needs in the way that he has done. He and Mr. Edwards have done for these 5 young people over the course of the last year. So I have to ask you to think and understand really carefully what is best for the young people and how would we meet the needs if they were coming in. we are not for a moment talking about, for the future, for the ongoing purposes of service delivery, reducing service delivery. What we're saying is we will not choose to deliver it from a building which we recognise clearly to be unsuitable for purpose. And that, for me, is the nub of it. Mr. Edwards, you indicated you wanted to comment again.
Yeah, thank you, Chair. Just very, very briefly, when we met with the parents at the time of the temporary closure, you know, we hadn't thought of closing then. We did say to the parents that the children didn't settle, and of course, Minster View reopened, they would go back. So I just want to say now that if there are parents that want to talk about their children being placed in the new Minster View provision, then that's absolutely something that we would want to look at. The majority of those children really settled. I don't think it'll be an issue. But you know what we will do, and what we always try to do, is work with parents and carers to get the best possible outcomes for children. I just wanted to.
Thank you. So I suppose the recommendations that we've got in front of us are talking about ceasing the use of a particular building, not of terminating service provision or capacity. So that if we vote these recommendations through, the challenge for officers and colleagues will be to come back to the next committee with a report that assesses the estate we've got, including the recently acquired and opened homes and the increasing capacity that we have both secured and have agreement in principle to progress. And then obviously challenge to Councillor Girling and his committee is for them to determine the fate of this unsuitable building. What I'm saying clearly is I would like to give him the keys back and provide me with a building that is suitable to meet the needs of these particular children or children with these needs. Councillor Henshaw.
Thanks for that, Chair. I'm obviously looking forward to a future report where all of these sort of issues can be sort of considered. In particular, the way in which we provide services to this group of vulnerable young adults. Obviously, I mean, I've been to the existing place with another hat on, but I think we've got to grasp this nettle now and move away from places like this and move more into person-centred, individualistic, care in the community sort of provision. So in saying that, I think I'll abstain on the actual recommendations until the future report comes. It's not that I'm per se against the closure or the moving of services from this particular place to another, but I would rather wait until we look at this new way of working that I think we all agree should have been done a long time ago, and let's get on with it. Thanks.
Thank you. I'm not sure I can completely agree with you, Councillor Henshaw, insofar as, well, two things. One, quite specifically, these are not young adults. They are children and young people. Once an individual reaches the age of 18, they are adults, and they will be, their needs will be met through adult service provision. So we do need to just recognise that difference. I think one thing Mr. Edwards has already spoken of is that a move to better care and provision within community settings or homes is one of the reasons that there has been less need for lots and lots of places to meet these complex needs, and a reason for not working in huge institutional buildings. So that notion of having smaller settings, and I suppose I'd make the plea to you to think differently about your suggestion of deferring a decision. We need to decide today on the fate of this building. And that's what I would ask you to cast your vote on today, so that we can make a decision on the future of this building, which in my view should not be for delivering services to children with these needs. And I completely recognise your desire to have more information at a future paper, which will be the January meeting, at which point then cast another vote with your view, or your colleague, if Councillor Henry's back, but cast a vote at that time for the proposals on. So I would ask you to separate out the issues and to give support to the paper in front of you today. You will obviously vote in the way that you choose to, but my personal plea to you today would be to support us in what we're trying to do today, and then scrutinise us at the next committee on what we're now saying we will do with the whole estate and making alternate provision. So with that said, I will take us to the vote on this paper now. Recommendations are on page 43. All of those in favour? Thank you, colleagues. All of those. Any against? Any abstentions? Thank you, colleagues. That's carried. And thank you to officers. I know that this has been particularly difficult to work through because there have been so many different implications. I look forward to seeing what we read in January and to you continuing in the care of these children and young people. We're very slow today. Item 8 is the basic need programme of school expansion. There are 2 recommendations on page 47 of your papers, which I move.
I second those, Chairman, and reserve the right to speak.
Thank you. Do we have any questions, comments? Councillor Meakin.
Thank you, Chair. The government, in their 2019 manifesto, promised to deliver 300,000 new homes per year until 2035. What impact do you think the arbitrary housing targets set by government to local council will have on school provisions over the next 10 years? Will the delivery of these targets lead to massive school building plan? For example, in Hucknall, got 3 schools being built. Well, I think 3 or 4. All of them primary schools, but no secondary schools. Thank you.
Thank you, Councillor Meakin. Any other questions, comments? Councillor Welsh.
And really quickly, because I'm conscious that everyone else wants to go, perhaps. Obviously, I really welcome this. My question is, I assume that not all of these can actually go through to be actually expanded. And if so, is that going to be put on some kind of timeline? How is this going to happen? So yes, of course we want this to go forward. Of course we want there to be enough school places going forward. It's just what happens in the future, and when the decision has been made, and how local members will be kept update with regards to what's going on in their locality. But yeah, it's obviously a concern that we do have this situation, but it's not unusual across the country. At the moment, I don't think Nottinghamshire's in any different position than other areas, to be honest, and in some ways we're in a better position than a lot of areas. But yeah, it's just how we manage that going forward. So, for example, if we say Calverton it's not the right time, or that's not, what happens next, and how is that communicated to local members, please? Thank you.
Can you switch your mic off, Councillor Welsh? Thank you.
Sorry.
Thank you. Councillor Girling, you indicated.
Yeah, thank you, Chairman. I thought it'd be appropriate for me to sort of comment in you come capping hand to me. I think it'd be good for me to comment, seeing you come capping hand to me to say, Keith, I need this extension, or I need this new school built. And I think it might be appropriate to sort of remind committee members how it works really. When there's a new development, and actually the EDAM committee have now put a paper out to go to the districts and boroughs about 106 agreements, because that's where, and still in fairness, but 106 agreements are basically where the money from the developers is got to do things like build schools, to do things like build care homes or whatever it is, the need of that area. Now, in your department, you have a very experienced team who work out school placements based on any development, and it's always told to me that it's not an exact science, but they're using their years of experience to work out what that is. I think it's fair to say in the past, some districts and boroughs have not been brilliant at asking for the 106 money required to be able to build those schools, and just thought, oh, well, the county council, it's their responsibility, their statutory responsibility to build the schools, which it is. However, it's also the districts and boroughs' responsibility to ensure that any money taken from the developers goes towards that. And that's why we've done that paper, to highlight that. And also, just to reassure members now, that actually, as we build new schools, they're always built with the possibility of expansion. So that if the predictions are incorrect or turn out to be not enough, we have got the space, if you like, to build, to extend like we are doing with this. Because rather than just build a big school and only half fill it, and then you've got all the expense of heating it, running it, cleaning it, maintaining it, this is the most efficient way of doing that. And so that's why things like this then come to us, that's a technical term, papers like this come to committees to say we now need to expand. Yeah, and that's the right way of doing it. Otherwise, we could spend a lot of money putting things in place and then they don't actually get used. And we are seeing around the county actually where some schools we want to close because the pupil numbers there does not justify that school being open. So to me, this is the right way of doing it. I appeal to anybody that's double-hatting in a district or a borough to make sure that when you allow developments in your area, that you actually ask for the appropriate amount of 106 money so that it can be used towards the schools. And, you know, we all know about government targets in terms of housing. As districts and boroughs, they will also know of how many people are on the housing list and that there always need to expand the housing market. Because we also know there's a lot of people living at home where actually they would like to have a house to live with their new loved ones and things. So this is all really part of the big picture. It's the way it comes forward. I think it's the only appropriate way for that to happen. So I'm going to support this paper.
Thank you. Before I take your question, Councillor Carr, I'm just going to correct Councillor Girling on one thing. And I could have misheard you, but I think you said because of overcapacity risks that we may be thinking about closing some schools. I maybe misheard you. And I just want to be very clear, it is not the policy of this council or this government to close schools. In recent times, within the last 2-3 years, this committee has considered 2 schools in difficulties, one of which had been running empty for a year, Sutton Air Manors, which was literally running empty, and where we had to go through formal processes in order to close it. That was an empty school. And in more recent times, where at the request of the leadership team, the governing body of North Clifton School, we have had to open formal consultation because they were concerned about their own viability. We're still in process with that insofar as consultation's been underway. The school and the community have rallied around very, very well to seek to secure the viability of that school, and things are much, much different there. So I did just feel the need to correct that, and it could have been my mishearing, Councillor Girling.
If I could just go back, thank you for that correction. You're absolutely right, which takes me on to a previous paper where sometimes if all you do is focus on the building, you miss out on the services that actually should be provided. So I do apologise.
Thank you, Councillor Girling. Councillor Carr, you raised your hand.
Yes, I hadn't picked up on that, so thank you for highlighting it. But I accept your explanation. Of course, I have to come back to, and you're absolutely right, Keith, that it is the duty of the boroughs and the districts to actually collect as much 106 or SIL as they can. I'm aware that some districts and boroughs haven't been as fastidious as they should be, but I have to say, I mean, I've been a Broxtowe Borough Councillor since 2003. I'm currently the Deputy Leader of Broxtowe Borough Council, and as far as I know, we've always asked for Section 106 monies for education where we can, and that's the important thing, where we can, because very often we put forward to applicants, well, this is how much we want from you with regards to the formula for education. Of course, we can only ask for it if there's a capacity issue at local schools, and very often it's challenged and it has to go to arbitration because they claim that it actually will diminish the amount of profit that they get from that development, and sometimes districts and boroughs have to reduce the amount that they ask for, and I think that is where the problem lies, in that arbitration with regards to it. Quite frankly, if you're building something and there aren't enough schools there, then you should be contributing as a developer to providing those spaces, and I fully support that. Of course, in the south of the borough, we're going to have huge issues for delivery of housing, which is going to mean that the green belt in a lot of the south of the county is going to be at risk in areas where there is very little large school provision. In the Chetwynd Barracks, which is the largest brownfield site in the south of the borough, is now not going to close until 2 years later than it was anticipated. That is going to put huge pressure on housing figures to be able to deliver from brownfield sites, and so that is something that I think, as a county council, we should be looking forward to. Where are those houses going to have to be built to deliver, and what is the school provision in those areas now? Because I think you'll find that the school provision in those areas won't be sufficient for the number of houses that may have to be built.
Thank you, Councillor Carr. I was going to bring, I think, Marion in. I don't know if Michael needs to comment as well, because he does a lot of the pupil place planning for us. But if I ask Marion just to address some of the process issues first.
Okay. Thank you. And Mike, I will check with Mike on the accuracy. This is very detailed work, and that is the work of Mike's team. Councillor Girling, I think, has answered and clarified many of the questions raised. With regard to any reference to housing targets, there is a process by which the requests by the district councils for funding is made. So that's number one. The second point, I think that the first councillor spoke made was with regard to Hucknall and secondary provision. If I've got that mixed up with Councillor Welsh, apologies. Firstly, the primary birth rate has stabilised, if not declined, and the bulge in the primary age going through the secondary schools has, it will more or less stop over the next year or so. What you have in Hucknall in the secondary schools is a significant number of children who live in Nottingham City, and the developers know this as well. Developers will contribute to places, obviously, for the developments and for the locality. And what will happen over time, over a period of time, is that local children will essentially have higher priority for the school places in Hucknall. And so the data is scrutinised, and it's not just scrutinised with lived experience, although that plays a part. There is a national data return. It's called the School Capacity Return. It's made yearly, and the data is scrutinised by the DFE. Our data is scrutinised just as every other local authorities is scrutinised. So experience is absolutely vital and essential, but the data is also validated by the DFE. And as Councillor Welsh said, Nottinghamshire is probably the envy of very many other local authorities with regard to sufficiency of school places. So Finally, I think the question was from Councillor Welsh about, yes, you're right, once the feasibility is undertaken, there will be recommendations, because in some ways, because of lived experience, we know that all the plans won't necessarily go smoothly, and indeed not every single one of these would necessarily be required. Members will continue to be updated in other basic need reports, and reports regularly go to the property committee as well, but can be cited around which are going through to the next stage and into becoming an actual programme. So in actual fact, routine reports will pick up and provide updates for you over time about which programme is going ahead. Can I just check with Mike that I haven't said anything that needs to be clarified, Mike?
No, you're... Sorry, Marion. You're absolutely spot on there, and the projects that go from feasibility and which may be some or all of these, they produce what's known as a latest estimated cost report, which elected members will be cited on.
Thanks, Mike. Thank you, Marion. Colin, was there anything you wanted to add? No, thank you. So if I can just pick up on a couple of specific points, because Councillor Meakin, you're very patient with every item. You always ask the first question and you're always the last one to get an answer. I think Councillor Girling touched on it in significant part, but from my point of view, I would answer you that no, I don't think that new housing targets directly from government or calculated locally, whichever way, are going to be leading to specific issues in terms of sufficiency of school places. I know that my grandmother had an expression, new house, new baby, but to the best of my knowledge, moving doesn't simply create those new births. And as Councillor Girling said, people are already living in places, be they rented or other accommodation. So I don't think the housing targets are having a direct impact on the population growth. And I think that's an extrapolation too far. So no, I don't think that's going to particularly challenge us. I do, however, acknowledge the challenges that you already face. And I hope that Marion's explanation at least helps you with that over time, local children moving into those new houses will have that prioritisation above those who are coming in from the city or elsewhere. I think, to be fair, everything else has been said that needs saying. Officers are working very hard with district and borough colleagues. I think that there is a stronger relationship and dialogue now between county and boroughs and districts over Section 106 SIL monies and the need for us to have tripartite agreements when we're working with developers. It was actually a pleasure to be able to agree with Councillor Carr's comments. It won't happen very often, so let's neither of us hold our breath. Absolutely. Councillor Smith, did you indicate?
Thank you. I've just, Councillor Girling said everything I was going to say in relation to Councillor Meakin, so I'm not going to go on to that. I just want to thank officers. Members of this committee might not be aware, but there's been a huge piece of work to get us to the paper you see in here, and that is to do with potential changes of planning areas and the removal of standalone planning areas. If you see on page 50, Farnsfield is one of those that we're asking the DfE for permission to expand and take away that. There's been a hell of a lot of work in Mike's team and Marion's team that Councillor Taylor and I have been involved in, and that's enabled us to get to this point and enabled us to propose funding through basic need for those particular areas. So just a massive thank you to officers on that piece of work.
Thank you, Councillor Smith. So, given that it is almost 1 o'clock, I think I'll take us to the vote on this one. All of those in favour of the recommendations, please. Thank you, that's unanimous. Item 9 is delivering the whole family safeguarding programme. We have 2 recommendations at page 63, which I move. Do I have a second?
Those, Chair.
Thank you, Councillor Anderson. Do I have any questions or observations on this paper? You're all too exhausted, aren't you? No, so I'll really just wrap up on this one if I have no questions and comments. I mean, I think this is a really significant piece of work for the department, for the committee to consider. We've spoken, there is more of a thread going through several of the papers now where we're looking at service delivery in different ways, and this is securing staffing and setting the scene for a transformation and change programme in the way that we're working in the department to deliver on a lot of those early interventions, early support and whole family support programmes that we've talked about in several other places. So if I don't have any questions, I'm going to take us straight to the vote on this one and ask all of those in favour. Thank you, that's also unanimous. And the very final item today is the work programme. There's one recommendation on page 66, which I move.
I second that, Chairman. Just can we add in on the January programme the Minster View recommendation for the development of the residential estate, please?
Yes, of course, thank you. And Councillor Carr, you indicated also.
Yeah, just an observation. Next meeting is January the 19th. We are under instruction to work from home when we can, but we can't because the government hadn't actually changed the law to enable us to meet virtually again. And can I ask yourself, Chair, and also the Service Director to ask Anthony, the Chief Executive, to make very strong representations to the government that they should be altering that so we can do what the government recommends.
Thank you, Councillor Carr. Councillor Welsh.
Yeah, there's a couple of things. Previously, we did talk about the fact that we were doing a review on all small schools, and that was going to come back to the committee. I've had a quick look. Again, I may have missed it, and I apologise, but I don't think that's on there. And if it is, I apologise. It's just because when Councillor Girling mentioned it, I did know that there was an agreement that that would come back. And the other thing that I was asking perhaps could be added to January in light of what the Prime Minister said last night with regards to the new variant and the upscaled vaccination programme in schools. I was wondering whether it would be appropriate to have a report on what is going on with regards to COVID regulations in school and what's happening. I mean, there's a recent health report that's saying that children at the moment are the biggest number of age category, secondary school, that are getting the COVID, and there's an enormous strain on school staff as well, that are having to isolate now for the 10 days, although that's changing on Wednesday and they just have to do a lateral flow test every day, I think. But there is a situation in schools that I think perhaps we might want to discuss in January in light of the fact that there may be changes in restrictions as well. And I was just wondering whether we could have maybe it has to come from public health, I'm not sure. But yeah, I think it'd be really useful for us to know what is or isn't going on, especially with the vaccination programme with young people as well, please.
Thanks, Councillor Welsh. Councillor Smith is correct that we have already agreed with the Minster View paper to actually bring a report in January, so I'll ask officers to bring that into the work programme. The small schools review, yes, you're quite right, we have agreed to bring a paper forward. I do know from conversations that Councillor Smith and I have had with officers, again within the last week, that work is well underway and ongoing. So again, I'll ask officers simply to timetable that and give us an indication of when that paper may come forward. I'm trying to see, Marion is still on the call, so that will be timetabled. You will recognise that the work programme is not definitive, it evolves constantly. And on the other issue, Councillor Welsh, I will ask officers to comment as to whether that sort of a report would be appropriate at this committee or, ironically, adults, because of the public health function sitting there. The one hesitancy I have about that is by the time the papers are published and officers have crafted one report, in the 10 days or week to 10 days to get to committee, who knows what the regulations will be. So it could be that we end up debating a paper about regulations which have changed in that window of timing, but totally acknowledge your request to understand what's going on in schools, and we'll take that up with officers. So thank you for your patience today. I think my New Year's resolution is going to look like how to chair and move meetings forward faster. So don't hold your breath though. If you'd like to switch the live stream off now, Stuart, thank you. And I'll bring the meeting to a close.
You'll be as pleased as I am that as we move through March, the days are getting longer and we're starting to see a bit of spring coming through and some